Assalamu alaikum. Today we are going to discuss a really very important and special topic in laparoscopy, which is called the ergonomics in laparoscopy. As you know that if you are driving a car and you are sitting comfortably, the steering wheel is at a comfortable position, the seat is comfortable, you can reach up to the brakes, your legs are reaching the brakes and the accelerator comfortably, and your hand can go everywhere you want. So you are comfortable and you are looking out through the front window and good view is available for you. So that would mean that you are comfortable and you can drive the car safely and enjoy the ride as well. But if you are not comfortable with the seat, or you are with the steering wheel, or with the vision for that matter, then of course you are going to be in trouble, and the drive is not going to be really very smooth and enjoyable, and you may end up in, God forbid, some accident or inadvertent event. So same is the case here with laparoscopy. So this topic of ergonomics is really very important. We must be having the knowledge about the ergonomics of laparoscopy, and we must get trained in ergonomics of the laparoscopy so that we are comfortable. So when the surgeon is comfortable, the outcome of the surgery is going to be good, and all the team and the surgeon is going to enjoy the surgery. So let's begin with our presentation. So I'm Dr. Akhtar Nawaz, working as Associate Professor of Urology and Renal Transplant at the Institute of Kidney Diseases, Hayathabad, Peshawar, and we are going to discuss this topic of ergonomics in laparoscopy. So here comes the introduction. What are the ergonomics? As I already mentioned, that it is a science of designing the job to fit the worker. So if the job is fitting the worker, is going to be comfortable and the outcome is going to be good. It involves optimizing the posture of the surgeon and the assistants, the optimizing of the tools and the environment where they are operating. And it also is known that specific ergonomic challenges may arise in laparoscopy due to instrument design and technique. As you know that the instruments are designed in a specific way. We are going to discuss this in detail. So the goal of the lecture and the training about the ergonomics and the knowledge about it is to reduce the surgeon's fatigue and injury while improving the efficacy and outcomes of the operations. Okay. So what are challenges in laparoscopic surgery? There are a lot of challenges, but some of the challenges which are relating to the ergonomics, we are discussing them here. So the first thing is that there is restricted range of motion due to rigid instruments. So the instruments which are used in laparoscopy are always rigid instruments. They are not semi-flexible, they are not flexible. And later on in this presentation, we will discuss that this thing is being overcome nowadays by developing robotics. So there are a lot of movements. The camera is flexible, the instruments can be flexible. So rigidity of the instruments in laparoscopy is one of the challenges. And the second thing is that there is fixed working posture. Like in open surgery, you can move around, but in laparoscopic surgery, there has to be a fixed motion, a fixed position, a fixed posture, and it is maintained for long periods of time. So long surgeries in laparoscopy in a fixed posture is going to be a challenge in laparoscopy. And there is always a two-dimensional view. However, this has now been overcome by development of 3D goggles and 3D screens, especially in robotics. This has really been overcome. But in laparoscopy, the challenge is the two-dimensional view with poor depth perception. So this is another challenge. Another important challenge, especially in the early part of the career of a laparoscopic surgeon, is the fulcrum effect. The fulcrum effect is known as that when you are moving your hands towards the left side, actually the view is moving towards the right side. And when you are moving your hands upwards, the camera or the view is going downwards. So this is a big challenge for the beginners. However, we urologists are from day one trained in endoscopy, so we don't have that problem really when we start with laparoscopy. But it may be a problem for laparoscopic, for general surgeons, because they are not very well versed with the endoscopic view and with the fulcrum effect right from day one. So once they start laparoscopy, they usually overcome it. So it is one of the challenges. And the other thing is that there is a lot of instruments being used within the abdomen. So the port placement has to be in such a way that the swirling effect is eliminated and there is no overcrowding of the instruments. And another important thing in laparoscopy, and which is a challenge, is a lot of equipment is required. So arrangement of that equipment in the proper way is really very important in ergonomically, because if the suction is too much far away from you and you are using a suction in your right hand and the machine is lying on the left side, so it is going to be a problem. The diathermy lead is coming from the wrong side, then it is going to be a problem. So there has to be an optimal operating room setup. So after seeing the challenges in laparoscopy, we are going to see the common ergonomic issues which are there for the surgeon. So the first thing is the neck and the shoulder strain from monitor misalignment. So if the monitor is not lying in a proper place, there is going to be a stress on the neck, the vertebrae, and also especially the sternocleidomastoid and the trapezius muscles. So they will get fatigued, and the fatigue syndrome will get in, and this will be an issue for the surgeon. And in the long run, the surgeon can develop cervical osteomyelitis. The other thing is the back pain from prolonged standing and poor table height. If the table height is very high, if the table height is too low, this will lead to a certain posture of the surgeon. So this may lead to strain on the spine. So backache is one of the long-term side effects of the laparoscopic surgeon. The hand and the wrist fatigue is really very important from the instrument handling. So the instrument should be in such arrangement and in such position, and should be made in such a shape that they should be not overstraining the wrist and the hand. So this is another issue which we are going to discuss. Visual strain due to screen glare or poor positioning. If the lighting is not good, if there is glare, there is a light behind you which is putting its light directly on the screen, and that glare is then giving you a hard time, because it is going and making your macula busy, your rods and cones busy, the retina is busy. So this will lead to visual fatigue and visual strain, and we will discuss that in the later slides. And there is asymmetric posture leading to musculoskeletal disorders, like for example, if you are straining too much on your left knee, if you are straining too much on your right knee, in the long term one is going to develop osteomyelitis of the knee. So these are the issues for the surgeon. Now comes the impact of poor ergonomics. So what are the impacts? The focus is not there. So the focus will be reduced, and the performance will get worse and worse over time. For the initial 10 minutes, 15 minutes, 20 minutes, everything will seem to be okay. But like for example, if you are holding the instrument like this, it will be okay for 10 minutes, 15 minutes. but in 15 minutes your trapezius is going to get fatigued, and after that you cannot hold your arm steady, you cannot do a dissection. If you are the cameraman, you cannot hold the camera in a proper position or in the steady position, and this will make the surgeon's life really difficult. So there is reduced focus and performance over the time. So, and there is increased risk of occupational injury, as I already mentioned, that there is disc herniation, there is osteomyelitis of the knee, and there may be tendonitis in the arm. And there are higher rates of surgical errors and complications. So the errors that a surgeon makes eventually appears in the patient, and so patient safety is really at risk. So, and another important thing is the early career burnout among the surgeons. So the surgeons, they burn out if they get tendonitis, if they get osteomyelitis, if they get sprains and strains and the backaches, so they cannot continue for long, and there is early burnout. And there is significant impact. All these things have significant, if there is, the patient is complicated, if the surgical burnout is there, this will pose a significant impact on the healthcare systems due to absenteeism. Surgical fatigue syndrome, here we need to discuss it. What does it comprise and what does it mean? So there is reduced ability to sense tissue perception, tissue characteristics, and depth perception. It will be difficult to differentiate between the fat and the vessel, between the fat and the ureter, between the ureter and the vein, between the ureter and, for that matter, the artery. So the tissue perception ability of the surgeon is reduced, and the depth perception is reduced. So all these may lead to errors in surgery, and you may end up in complication which will harm the patient. So what is that? That is usually the 4 hours performance, which is called the wall. So you reach the wall. The wall is 4 hours, and that is in the case of in the proper ergonomics. So you have to take a break. If the ergonomics are not good, the cameraman is not comfortable, the surgeon is not comfortable, this surgical fatigue syndrome can set in earlier than 4 hours. So what are the features of surgical fatigue syndrome? These are mental exhaustion. The surgeon is exhausted, and once he gets mental exhaustion, he becomes irritable. He starts blaming the assistant, the cameraman, the anesthetist, the OR attendant, the scrub nurse. He may utter some really stupid kind of jokes which he may not be saying in general conditions or in general public, for that matter, when he is comfortable. So that would mean that the surgeon has become irritable and he needs to rest. And this leads to impaired surgical judgment, and there is reduced manual dexterity. So all these combined are called the surgical fatigue syndrome, and this can affect the ability of the surgeon, and this may reduce the focus of the surgeon and the surgical capabilities of the surgeon, and will impose a risk upon the patient for developing surgical complications. And for the surgeon, there is a proposed high and significant cardiovascular risk. So you need to have calm and relaxed posture, relaxed mind, and relaxed mood to perform a surgical procedure. So what are the principles to avoid all these things? What are the principles of good ergonomic practice? These are, number 1, starting from the monitor, starting from the equipment. So the monitor should be placed directly in front of the surgeon at the eye level, so that the ocular muscles are not strained. So if the ocular muscles are strained, like for example, if it is lying towards one side, so you will be doing this, the neck will be strained, your eyes will be strained. If the monitor, for that matter, is really very high from the surgeon is short and the tower is high, so he'll be looking like this. This will lead to fatigue as well. So monitor should be directly in front of the surgeon, not towards one location, and it should be 10 to 15 degrees below eye horizon. So my laptop here is lying in a comfortable position. I'm looking down on the monitor rather than looking up towards the screen. So this is the comfortable position for the eye. And this is for the ocular muscles, but for the retina, the monitor should be placed at such a distance from the surgeon that it should be the 5 times the diagonal length of the screen. Only then the macula will be receiving the good colors. So this is the ergonomic for the monitor. And for the OT table, the operating table should be lying at such a at such a height that it should be at the level of the symphysis pubis of the surgeon, and it should be at such a height that the elbows are at the 90 degree. They should be flexed at 90 degree. If the table is too low, the elbow will be in extended position. If the table is too high, the angle of the elbow is going to be more than 90 degree. So the handle of the instrument, the handle, it should be at the level of the elbow. So only in that case the elbow will be in the 90 degree, and this is the most comfortable position for the elbow, and this is the comfortable position to avoid fatigue. At times, if the procedure is really very long, there should be a trolley or some support. Whenever available, the surgeon should place his or her arm or forearm or the elbow on the support. Another thing is that if there is the surgeon is not comfortable with that, the table can be made as lower down as possible so that the surgeon can sit on a chair and perform the surgery. And for the cameraman, if the surgeon is holding the instruments at the level of the elbow, but the cameraman has to do this to overcome the arms of the surgeon, then there should be a platform on which the cameraman should stand and the height should be adjusted. If the surgeon is really very short and the table is high and the proper height cannot be maintained, then the surgeon should stand on the platform to compensate for the height. The instrument entry point, this is a really very important thing. I have mentioned this in one of my lectures on the port placement. So the ports should be placed in such a manner, whether it is a circular technique, whether it is a triangular technique, or whether it is a baseball diamond technique. But the entry point of the instrument should be such that the instrument, half of the instrument is lying inside the abdomen and half of the instrument is lying outside the abdomen, so that the awkward angles are they are avoided. So the entry of the instruments is really very important, and you can refer to my lecture on the port placement. And the stance of the surgeon is such that the feet should be such apart that they should be shoulder width apart from each other. They should not be too near to each other. They should not be very wide, because that will make the weight of the surgeon in a mild distribution. So it is not evenly distributed, will again lead to some awkward posture, and by the end this will appear as in the form of complication or surgical fatigue syndrome. So let's see this diagrammatically. In this diagram, it is really very easy. You can see that the OT table is at the height of the symphysis pubis of the surgeon. The other important thing is that the handle of the instrument is at the level of the elbow, and the elbow is at 90 degree flexion position. and the monitor is right in front of the surgeon, and you can see that the center of the screen is 10 to 20 degree below the eye height. So this is the optimal position. Here you can see in the second diagram the same things. There is a support lying for the surgeon. Whenever surgeon feels that he is fatigued, he or she will place her or his arm on the support. And the rest of the things we have already discussed: the flexion of the neck, the arm by the side support, the relaxed hand grip. You can see hand grip we will discuss in next few slides. Then you will the point will get clear to you. And if there is shorter height of the surgeon, you can place a platform. And there is okay, yes, the lighting is really very important. It is mentioned here. While looking at the monitor, the lights of the operating room in front of you and on both sides, they should be turned off, so that you should not get a glare, number one. Number two, your macula should not get strained, because if I'm looking at the screen right in front of me and there is a light in front of me on the roof, so that light is impacting my retina and my macula, so I will not be getting the full colors, and the depth perception and the tissue perception will be impaired. So all those lights should be turned off. Okay, so moving on to the next slide. Here you can see a very bad position. The screen is lying towards the foot end of the patient, so the surgeon has to bend his neck at an angle that soon he will get fatigue, and he may get osteoarthritis of the cervical vertebrae, and his elbow of the left hand, you can see that the left arm, the elbow is bent too much, and you can see the position of the wrist as well. The wrist is bent too much, so this will get fatigue, and there is chances of osteoarthritis. So if he or she is performing varicocelectomy or a diagnostic laparoscopy, which will last for 10 to 15 minutes, so he may get through get away with the position. But if it is a long pelvic procedure, he may not be able to carry on. Here the surgeon is comfortable. There is a screen for the surgeon and for the assistant. There is another screen behind the surgeon for the second assistant, but you can see that the cameraman is holding, or the camera woman is holding the camera in such a position that she cannot carry on. So if in this position, so if there is a platform for her, I think this is just because of the height of the assistant. If there is a platform and she stands on that platform, so the angle of the shoulder and the abduction will be gone, and she will be in a comfortable position, because in this position, after 10 to 15 minutes, she will get fatigue, and all this fatigue will get transferred to the view of the surgeon, and the surgeon will not be able to continue, and then he will have to change the cameraman too. So this posture is really very important. Here again, the cameraman is standing really very comfortable with the posture, but you can see the position of the surgeon. By looking at the port placement, we can see that he may be performing a varicocelectomy, so which is a 10 minutes procedure, maybe 15 minutes he can carry on, but they cannot carry on for long if it is a radical cystectomy, a ureteric reimplantation, or for that matter a radical prostatectomy or cystectomy, or even pelvic lymph node dissection. So this is a wrong posture. The setup of the operating room, as I discussed in the earlier slides, that there is a lot of equipment, and that equipment, if is placed haphazardly, this may lead to a lot of problems for the surgeon ergonomically. So the setup of the operating room has to be such that it is fitting the ergonomics for laparoscopy. So the monitor is placed in line with the surgeon's gaze. The instrument trays are arranged in such a way that they can be accessed easily by an assistant or by the surgeon or by the scrub nurse. Okay, so the lighting is optimized to reduce the glare. As I mentioned, that the lights which are glaring on the screen or which are directly affecting your eyes, they should be turned off. So the lighting should be optimized. The assistant and the team position should be in such a way that they are coordinated to reduce the congestion around the patient, and they should use adjustable stools or anti-fatigue mats for long procedures. Sorry. So this is the setup. You can see here that the patient is lying here, the surgeon is standing there, and the screen is right in front of them. The scrub nurse is towards the foot end, and the laparoscopic instruments are in her axis, and the open trolley is also there, and the suction machine is lying towards the right side. The diathermy is lying right in front. So there is no jumbling up of the various equipment. Then comes the design of the instrument and ergonomics, as I discussed previously, that we will discuss it in detail. The ergonomic handles, they are reducing the grip, like for example, the fatigue, sorry, the grip fatigue. Like for example, they should be pistol shaped rather than in line. We will see that as you see that the usual instruments are like pistol. So they reduce the fatigue to the wrist, which is called the grip fatigue. And while the needle holders usually they are in line, so the handle is in line with the instrument, and that actually leads to the grip fatigue. The other important thing is that in the beginning of laparoscopic surgery, the surgeon is placing the thumb in the handle, and that leads to numbness of the thumb for long periods of time. But after getting accustomed and getting through the learning curve, the surgeon learns to keep the thumb outside the grip or the handle. So this is another really important point to be noted. And the instrument should be lightweight and well balanced. Like for example, if the handle is too heavy, then it's really difficult, and the ergonomics are not really good. So it should be they should be lightweight. And nowadays the disposable instruments are available, which are mostly made of the plastic, so they are really lightweight. The length and angulation of the instruments must match surgeon's anthropometry, as we already mentioned, that the port placement should be such that the tactile feedback is really crucial for fine motor control. So tactile sensation is usually not there, but every effort should be made in the instrument so that one can differentiate between a soft tissue or a bone at least. And sharp instrument should be avoided, and on the instrument should be crafted such that on the handles there should be no sharp points. Here, a really very important thing, on the right hand of the surgeon, you can see that transducers are there. So during the training and during the research, they have seen all these transducers are connected to the computers, and they can measure the fatigue of the muscles in different positions and different hand movements. So there is another diagram here. Here you can see the grip fatigue, the position of the wrist while holding the needle holder in the bottom picture, while in the upper picture you can see the position of the wrist. So you can compare the positions of the wrist in the pistol type instruments and in the inline instruments, and the transducers are there to measure the fatigue. So the important thing is training in ergonomics and simulation, spending hours on simulation before going to the patient, so that the surgeon or the trainee must know what is the optimal position and to carry on the surgery, and what are the positions which I should avoid. Like, for example, I did this surgery in that position, and then I had a backache, and then I had an ache in my knee, and then I had fatigue of my neck muscles. So training and simulation is really very important in laparoscopy before going and practicing it on patients. So simulation labs, they allow practice in ergonomic postures. Video analysis also provide feedback on posture. Like, for example, in training or in simulation, the supervisor is making a video of the trainee, and then later on that video is shown to the trainee that, look, your elbow was not in a ergonomically good position, your shoulder was too much abducted, your neck was bent, so, and you were not standing in the right posture, your weight was not balanced, you were standing, all your weight was on one knee. So videos can really help. There should be curriculum which includes awareness of strain inducing positions, already discussed, and we must incorporate checklists. So making video, and then a checklist should be there to monitor the ergonomic compliance, whether the trainee is complying to what he has been taught. And then ergonomics should be part of surgical education, already mentioned. So part of the education, as we mentioned, these are the basic angles that a trainee must know. That what is a azimuth angle, what is manipulation angle, what is the optical axis, what is the elevation angle. So the trainee must be aware from all these angles. It is not only the port placement or the angles or the surgeon's position that all these angles and the position, the monitor, the cautery, the diathermy, the suction, the assistant, the trolleys, all these comprise and they all combine, they make the ergonomics, what is called the ergonomics of the laparoscopy. So we talked about everything, and these are the angles. So the angle between the telescope and the one working element is called the azimuth angle. The angle between two working elements or two working instruments is called manipulation angle. The angle that the instrument is making with the patient or the skin is called the elevation angle. So these have to be taught to and to the trainee before going to the laparoscopy. He must be aware, or she must be aware. So what are the recent advances and what are the technologies? Till now we have discussed the problems, the issues. So what is the solution? The solution is robotic surgery. So robotic surgery has tremendously reduced the physical strain, and it offers seated position. You are not holding the camera, the robot is holding the camera. You are not holding the needle holder, the robot is holding the needle holder. You are not standing anymore, you are sitting, and you don't have to worry about the camera. The camera will not be towards one side, it should be right in front of you in the console. So all problems have got one solution, which is called robot. Of course it is expensive, everything comes at some cost. Wearable sensors should be there to track and correct posture in the real time. As we saw previously, that transducers were there, motion sensors were there. So if you are standing in a wrong posture, there should be an alarm or some system to inform you that you are not in the proper position. So then you will of course you will correct your posture and your position. There should be voice or foot activated devices to reduce hand movement, like for example suction. like for example diathermy and others. And the smart or modular operating rooms should be designed in such a way that all these ergonomics should be kept in mind, and the surgeon's ergonomics are kept in mind. So nowadays modular theaters are there is a lot of space, and you can very freely move around all the equipment around the operating table, including the insufflator, including the monitors, including the surgical trays, including even the anesthesia machines. Um, of course, augmented reality is another thing which we can integrate, and we can improve our vision and visualization of the tissue and everything. I hope everyone knows what is augmented reality. Augmented reality is uh, merging the images of the MRI, the CT angiogram, or for that matter, a 3D CT, and the actual image which is coming from the telescope. So they are merging all of them to each other to know exactly where the surgeon is working, what depth the tumor is lying, like for example performing a partial nephrectomy. So which artery is feeding, which artery do we have to clip, and which artery do we have to save, and what is the depth of the tumor to avoid positive margins. So augmented reality should be used. And this is just a diagram of the robot. You can see that the surgeon is sitting relaxed using the pedals for diathermy and suction, and there is no instrument in her hand or his hand, and he does not have to strain to look into the monitor. So the conclusion of our presentation today is that the laparoscopic ergonomics are really very important, and they affect the surgeon's health, his safety, and the outcomes. So this is one of the conclusions. So ergonomics is affecting the surgeon's health and his performance and the outcome. Of course, awareness and training can prevent all the injuries, and they can prolong the careers of surgeon. As I mentioned that they cannot carry on for long then, so they have to quit. So all this awareness, knowledge, and the equipment and innovation can lead to prolonged surgical careers. And ergonomics of the operating theater and design of the operating theater, the design of the equipment can all lead to overcoming all the issues of the ergonomics, and can lead to patient safety and surgeon safety. And last but not the least, the action which is needed is to promote ergonomic practices and innovation in surgical education. I think this is the last thing, that the innovation should be there. Nowadays artificial intelligence is coming into the laparoscopy, the robotics, and this will help the surgeons by training more and more trainees which are ergonomically more efficient, and the outcomes are going to be good. Thank you very much for listening. Thank you very much.